Hi everybody, it's Teresa, the dental assistant tutor here, and we're going to go over part 2 of the radiology review. And I had a little more time to prep, so we're going to get this together. Okay, so I hope you have a textbook. I mentioned a few the other day that we have that's circulating out there in dental assistant schools, so make sure you have your textbook, piece of paper, pencil to jot down notes. Or if you're one of my students, you have your study guide from the program. Make sure you have that. Alright, so we're going to do some reviewing from yesterday. Just in case this is someone's first time watching this video. I wanted to review dental radiology. Let's talk about the PID, the position indicating device. That's where we left off at yesterday. And we were talking about the tungsten target, the cathode, the electric cloud, the filament, the vacuum, the anode, and the glass envelope, okay? Now, I want to review that anode is positive, okay? So you need to know that. Write that down. Anode is positive. Cathode is negative, okay? Now, another way to remember is I have put A is before Z. That's a good way to remember it, okay? And A is positive. So A is first, positive is plus, is before minus, okay? C comes after A, so just remember, positive, A plus. You're going to get an A plus on this exam. If anything, you're going to pass it. So let me talk about that real quick before I get sidetracked, as my students know I sometimes do. So bear with me, but you're going to get the material because they are getting hired. Praise God on that. The DAMI RHS exam was developed by the Dental Assistant National Board in consultation with an expert team. So a team put this radiology exam together. It consists of 100 multiple choice questions. So just so you know, the RHS exam has 100 multiple choice questions on it. Now, here's the percentile when it comes to the subject so you can study. Okay, you have to pass all the parts. Intraoral and extraoral. 37% of the exam is about the x-rays inside the mouth and outside the mouth. Processing the x-ray, developing it and all that good stuff is 16%. And then mounting and labeling is 11%. They're probably going to ask you questions about sinus markings and how can you tell that that x-ray goes where. Okay, so you need to know how to mount x-rays. Radiation safety for patients. That is a big one. A lot of people don't pass that part, okay? So make sure you study radiation safety for patients. That's 24%. And the radiation safety for operators. That's 12%. Okay, the exam may be taken via computer or on paper. Exam scores are placed on a scale of 100 to 900 with a minimum passing score of 400. Okay, so it's totally different. It's not like you get 100% from your teacher. This is a up to 900 score you can get. Okay, and there's only 100 questions. And you need 400 to pass it. Okay. There is no precise number of correct answers required to earn a passing score because versions of the DAMI RHS exam vary in difficulties. So just because I have two students that are going to be taking the exam here pretty soon and they're both working together, proud of them, shout out to them, they know who they are. But with that being said, she might get a totally different test from the other students. Okay, that's what this is saying. A performance rating of low, average, average, or high average is provided for each subtest and can be used to improve scores in the future. Exam results are not released to anyone besides the candidate, okay? And then what's going to happen is once you do pass this exam, because you're going to study for it, and with my help and your instructor's help, if I'm not your instructor, you're going to pass this exam, and when you do, you're going to fill out the application for your state that you can add a license to your license, okay? So it would be your radiology certificate, and they will contact DAMI for that information, and you would give them a copy of your scores and stuff like that, okay? And that is only $15, so you're finally getting some relief, okay? I wish I was with this heat wave, but make sure that once you, I know it's a lot to pay for this radiology exam, okay? And I think there's a few other things that might cost a pretty decent amount. I think nitrous has gone up and chronopolishing, okay? But you can find those classes online at Dent Ed. Check that out, dented.com, and that's local everywhere, okay? All right, so that's ano and positive, okay? Cathro is negative. Ano is positive. Now, you notice there's the filament right there, okay? Right there. That's the filament. Then we're going to review long wavelengths and short wavelengths. We talked about the other day that short wavelengths are stronger, more powerful, and are the ones that are used for the x-rays on the film. It's high energy, okay? So remember, the shorter the wavelengths, the higher the energy. The longer the wavelength, the lower the energy, the frequency of it, okay? So I made this little diagram up for you to see, okay? So you got your, I'm working in the garden, so my hands are messy, don't look at them. But you got the short crests in between, okay? The shorter the crests are, these little peaks and valleys, that is crests, okay? They might ask, what is this? The mountain. It's the crest mountain. Colgate Crest Mountain, whatever you want to call it. Make something up to remember that. Then you have the long wavelengths, which takes longer, and you're going to lose some, so your picture will be less, okay? Let's talk about the tube head. Take a good look at that, okay? Right here, you have the filament, which heats it up, okay? And then it shoots it over here to the tungsten target. That white spot's the tungsten target, okay? And once it hits the tungsten target, see the little black dots going out the PID? Okay, so it's going to warm up when you push that button, heat it up, okay? It's going to go over this way, it's going to connect with them, and then it's going to shoot out of the PID. I don't know if you can see this over here. I don't think you can, but I made the tube head. So remember, right here is the wires inside the arm, the part that is connected to the wall, okay? It's connected to the wall, and you're going to take it and you're going to bring it over so you can take an x-ray, okay? Sometimes, like on Bob over here, okay, the chair is sitting here, okay, and your tube head fits right here, but then sometimes the room's not big enough to go around and put it right here. Sometimes you might have to adjust the chair on the bottom, adjust it, and then do it, okay? So remember that. Let's see, what else? Oh, the oil. Remember, the glass tubing inside the tube head will be around, all around, okay? The glass tubing holds the oil, okay, that warms up. Don't forget you got the copper housing, and when I was going through all the books reviewing them, some of them don't always call it the copper housing. Some of them call it the copper rod, okay? So remember that. If you see a word rod or housing on your exam, and it says just it has copper to do with it in front of it, not copperhead like the snake, like I said yesterday. Cheesy jokes, I know. Just trying to keep you guys awake. But copper, housing, or rod, all that goes together, okay? And then remember that the ano, the positive side, goes with the tungsten target side, okay? The part that has the filament that heats it up is cathode, it's negative. Okay, now I hope you really can see this. I don't know if you can. But this is an atom, okay? The atom is round. inside the atom is a bundle of nucleus positive. All around it is negative. That what makes up the atom. Okay? The bundle. Right there. Okay, remember also that the filter right here, right on the inside of the PID. Pretend this is my PID. Okay? There's a filter right in here. That is made out of glass. Unleaded glass. Filter made out of unleaded glass. Remember, if you have a square PID, the part that points to the patient's face, if it's square, then you're going to have less scattered radiation because the film is square. Okay? If you have a round one and the film is square, which it is, then it's going to shoot at the film, but then it's going to scatter. Like that. Remember, anytime, oh, one more thing. Anytime there's scattered radiation, you take the picture of Bob, his teeth, it hits the chair, then it's stopped. It does not go through anymore. But I wanted to talk about this. All these little dots in the middle. Okay, all these little dots. That is, I think I have a closer picture for you. That is the electric cloud. Okay, electric cloud. I'm going to take pictures of these and upload them with my blog. So you will have this right there as you're watching the video so you can look back and forth at it, okay? That might make it easier. Okay, so I can't ask you guys. I forget. That's a camera. But anyway, tube head. Let's go over it one more time. Inside the tube head, you have to know this stuff. Cathode is negative. Anode is positive. Electric cloud is the little ones that are going like a bunch of little flies in the center, going to the other side. You've got the oil that's inside of the glass envelope, that it goes all around inside of it. The glass unleaded filter is right there at the beginning. It's a solid line. Remember that. And then the two little lines that are at the very opening of your x-ray, okay, the very tip, there's two opening ones. That is the diagram, okay, diaphragm. So know that, study it, because you're going to see it again. Okay, so once again, long wavelengths are what? Can't hear you, just kidding. Is weaker, and then the short wavelengths are stronger, okay? Which means high energy, and if it's weak, low energy, okay? And then the crests are the peaks and valleys on either long or short, okay? And then the wavelength is the whole thing going in between each one, all right? Like I said, I'll upload those. Now, I want to talk about something else. Central ray and bisecting angle technique, okay? Parallel angle technique and bisecting angle technique. People get these confused. So I'm going to tell you guys how to remember it, okay? The central ray in the tooth and film packet is all parallel, okay? But there's a space between the tooth and the film. See right here in yellow? That's the space between the tooth and the film. That's how you know you're doing the parallel angle technique. The bisecting angle technique is where the tooth is actually touching the film. All right. What is a LoRa? A low as reasonable achievable, right? I'm going to jump into what most are waiting for, the practice exam, okay? Now, I'm going to read it And you can write it down. You can pause the video if you need to. Some of you guys can write fast or type, so everybody's at their own level in their own comfort of their own home, which is why I'm doing this video. Don't forget to like and subscribe, by the way, because there will be more great videos coming. Okay, so proper prescribing of radiographs is an example of a patient protection technique used before X-ray exposure. You need to know that, okay? So proper prescribing of radiographs, because you can't just take X-rays just to take X-rays, but some will do. I'm just saying, know that. Proper prescribing of radiographs is an example of a patient protection technique used before X-ray exposure. You need to know this. The climatometer, C-O-L-L-I-M-A-T-O-R, restricts the size and the shape of the X-ray beam. Okay, climatometer. Okay, restricts the size and shape of the X-ray beam. 16-inch rectangular PID would be the most effective in reducing patient exposure. Reducing patient exposure is by using a 16-inch rectangular PID. Okay. F-speed film is currently the fastest intraoral film available. That's F. On some dental x-rays machine, only the exposure time can be altered. The other parameters are present by manufacturer. Okay. So only on the dental x-ray machine can you adjust the exposure time. Sodium sulfate is preservative used in fixture solution. Sodium sulfate, you need to know what that is a preservative used in fixture solution. Okay, sodium salt, we know salt is a preservative. So, hey, that's one you got right on the exam already. The purpose of hardening agents is to harden and shrink the gelatin in the film emulsion. Okay, remember, on the last video, the first one, gelatin is the emulsion on the film. Once it's dipped into the fixture, it is then creating and keeping it there. The master tank is filled with temperature-controlled water. Temperature-controlled water. Okay, you don't want to use too cold. You don't want to use too warm. Remember, if the water is too cold, it's going to show up what? Too light of a film. If the water's too dark, it's going to show up too hot, it's going to show up too dark. All right. The temperatures of the developer and fixture solutions are controlled by using a mixing valve. Okay. A thermometer may be clipped to the side of the developer tank for manual processing. Or they actually have one that floats in the water. That's the one I used to use. It was glass and black. And it just, you would check the temperature. Remember, if you're just turning on your automatic processor in the morning, you have to let it warm up. Also, keep in mind, you do have to keep those rollers clean. There's that spray 2000 that you can use. Spray it, let it soak, rinse it. You want to keep that going. A thermometer may be clipped to the side. Okay, I read that already. Developer solution should be changed at the same time as the fixture solution. So know that. Change everything at one time. Every day you should tap it off though. Add some to it. Replenish it, it's called. Replenishing it. Deposits form on the inside of the walls of the insert tanks because of the interaction between mineral salts and water and carbonate in the processing solution. I'm going to repeat that again. Deposits form on the inside walls of the insert tanks. So the holding tanks that you're agitating the x-ray in, it's going to get deposits on the inside. And because of the interaction between the mineral salts and water, carbonate in the processing solution. Which of the following is the component of a fixture solution but not developer solution? It's going to give you examples like potassium bromide, hydrochlorine, sodium carbonate. Remember, if you want to look at these words, pronounce it app, it's free. And then potassium alum. That's the one. So which of the following component of the fixture solution but not developer solution? Okay, so that's going to be potassium alum, A-L-U-M. That's the one that goes with fixture. It is not in the developer. Okay. The restrainer stops the development of unexposed crystals more than exposed crystal. The restrainer stops the development of unexposed crystals more than exposed crystals. Normal use of processing chemistry is defined as 30 intraoral films per day. Normal use of processing chemistry is defined as 30 intraoral films per day. Okay, 30 films, I know people might use a lot more than that if they're doing FMXs all day long. So they're saying that you have to change it. But for your exam, because that's not going to happen, you're not going to have the time to do it. But anyway, for the exam, 30 films is the processing per day for the chemistry. Okay. This word I'm going to spell out to you. Hydroquinone. Hydrochlorine generates the black tones in the sharp contrast of a radiograph. Okay? Know that. The purpose of preservative is to prevent the developer solution from oxidizing in the presence of air. So that's why you have a preservative in the developer, because it oxidizes the air. Okay? Which of the following chemicals accelerate in developer solution? Sodium carbonate. Sodium carbonate is the accelerator for the developer solution. Know that. Give me 1 second, guys. Okay, you're going to need to know about semi-critical instruments. Semi-critical instruments. It would be the X-ray film holding devices. Know that X-ray, the ring kit, this right here, is semi-critical. Okay, because it's going in the mouth. Sometimes it gets blood on it, sometimes it don't. Depends if they got gingivitis. But know that semi-critical instruments, this is one of them. Okay, for the radiology exam. Cover exposed surfaces with disposable materials provide, while eliminating adequate protection, the need for surface cleaning and disinfecting between patients. So they're saying if you wrap everything up, the rule of thumb is once you wrap it up, you just rip that tape off on the buttons and you don't have to wipe. I have a pet peeve because sometimes there could be a hole in it, and nowadays you can't be too safe. So when I take my barriers off my air water syringe, I still wipe. I would recommend wiping it. But just know that you can, for the test, if it has a barrier, you don't have to wipe it. What needs to be covered on the X-ray machine or disinfectants? It's going to be the control panel, the exposure button, the tube head, and the positioning indicating device, which is connected to the tube head. Okay, remember you can take those PIDs off. Alright, if this was attached to the tube head itself, you could unscrew this and replace it with a square one if your boss wants to order one of those for less scatter radiation. Okay, I'm going to give you an example. Proper film processing occurs during and after X-ray film exposure reduces the amount of X radiation a patient receives. Proper film processing, okay? So what they're asking is the amount of X radiation a patient receives. Some of these questions you have to really think about. How does it reduce? Okay? Proper film processing. They might say retakes or something else, but you want to choose proper film processing. Reason being is, you take that x-ray right the first time, you're not safe yet. You still have to process it. If you drop it in the dark room, it gets stuck in the tank, or the digital sensor doesn't pick it up for whatever reason, okay, but the radiation button was pushed, well, that's one thing. So, proper film processing. MPD for occupational exposed pregnant woman is the same for that of a non-occupational exposed person. Okay, remember that. According to the current recommendations 2003 of the National Council on Radiation Protection and Measurement, the current MPD for occupation exposed pregnant women is the same as that for a non-occupational exposed person. You need to know that. So if you're pregnant, no difference with a non-occupational exposed person. The acronym for permitted lifetime accumulated dose is MAD, maximum accumulated dose. MAD is the acronym. They're going to ask you what the acronym is. It's MAD, maximum occurrent dose. Okay. Maximum permissible dose is MPD. The extension arm allows for positioning of the tube head. The extension arm. The one that has all the wires in it right here. Okay? It's like if I take my wires and it's in the extension arm and I'm turning it around and twisting it, so are the wires. So make sure you put it back the way you got it. Dentists are watching. Trust me. They pay a lot of money for those machines. Okay. Disposable styrofoam bite blocks are called Stabe bite block. You need to know that. Stabe. S-T-A-B-E. Bite block. That is disposable. The exposure light activates the maximum to produce x-rays. The exposure button. Cross that out, guys. Hurry. Exposure button activates the machine to produce x-rays. So once you push that button, it's going to produce the x-rays. Make sure you're not in the room. Make sure if you are in the room, you stand 6 feet away at a 90-degree angle. Remember that the film emulsion is on both sides of the film. If it was on one side, it was made for just a picture to be taken. 2 sides, it's an x-ray. The label side of the dental film packet is color-coded to to distinguish between one film and 2 film packets in between the film speeds. Remember that. The label side of the dental film packet is color-coded to distinguish between one film or 2 films inside the packet. And the video I did yesterday, if it's one of the ones that got uploaded, I talked about how color-coded side, distinguish. Oh yeah, that the second copy in there is for like insurance companies or something like that. Film is best stored at cool and dry, so it can't be humid like it is today. So it must be cool and dry. I knew some people left their film in the refrigerator before. Same with batteries. Which of the following areas would appear most radiolucent on a dental radiograph? So radiolucent. Radiolucent, remember, is any areas that are dark, that did not get penetrated by the radiation. Okay? Would it be a composite? Would it be enamel? Would it be a bracket? Denture? Airspace? It would be airspace. Airspace will show up radiolucent. Okay? Remember loosey-goosey, just get through. Okay? So, airspace. Also, they might say fistula. They might say periodontal ligament. All those can show up radiolucent. Where radiopaque would be your amalgam, composite, crown and bridge, earrings that show up. Those are radiopaque. Radiolucent refers to the portion of the process radiograph that is gray. Okay? Gray. Make sure you choose gray for radiolucent. Okay. A septometric is an x-ray that shows the bony and soft tissue areas of the facial profile. You'll see that on my dentalindexjunior.weebly.com site. I have a ceph and a pan up there for you to review. I do know orthodontists do take cephometrics. They're really pretty easy to take. If you get past the part where you think you're going to squeeze someone's brain in by pushing those things in their ear, make sure that their chin is parallel. I'll do it, even though you can see my double chin. But make sure it's parallel to the floor. And then you put those things in their ear with the adjustment right here. You line it up with the bridge of their nose. And then what it's going to do is take a side profile of that patient, okay? And then when it gets developed or instantly goes onto the computer, you're going to see my soft tissue, my big nose, my lips, okay? And all this too, okay? It's going to pick up all that. That's the soft tissue. But then it's going to pick up the bone, which is going to show up what? Radiopaque. The tissue will show up radiolucent. Remember that. They're really cool. And then the orthodontist draws on it or teaches somebody in the office to draw their degrees on it and what they need to move, you know. Let's see here. So much resources. I'm just trying to make sure. Give your hand a break. Wiggle them, stretch them. Make sure you do that throughout the day at your job. When you're bored or you're just sitting there waiting for the doctor to come in, stretch it out, okay? You don't want to get like me and get like a crooked finger, okay? I love dentistry, but it's done my body in. So make sure you take proper care of yourself. That's what I'm telling you. Okay. Learn from my mistakes, guys. Just learn from my mistakes. Okay. A solution of hydrochloric acid in water is the best choice for cleansing in the master and insert tanks. A solution of hydrochloric acid in water. They got that spray 2000. Works on everything. The major advantage of automatic film processing versus manual film processing is less processing time is required. Okay, but remember, if that video got uploaded, not sure, I was trying to work hard, but when you're putting that film in, okay, this is the unit. Let me grab my film over here. This is the automatic film processor. This is, you're standing right there. You're in the dark room. You're feeling for it. You know what I'm talking about. You open up the film packet. You're going to feed it in, right? Well, remember I said do one here, all the way on the right side. 1, 2, 3. Stick the next one in over on the opposite side. 1, 2, 3. Then stick the one in the center. 1, 2, 3. And then start again. If you got 2 FMXs to develop, you know, wait a few minutes in between too, because they're going to all be shooting out. You're not going to know whose teeth are whose. So, 1, 2, 3, 1, 2, 3, 1, 2, 3. Plus, by doing that, they're not going to overlap. So if I had two films right now and they overlapped and they went through the processing and the rollers and everything, then it's going to, you're going to have to peel it off. And just like a piece of paper I mentioned before, you leave a piece of paper on the desk, it gets wet from your coffee, and then you try to take the piece of paper up, and then it's stuck there. Same with this, okay? Remember that. The film clears in 2 minutes after the chemistry is of adequate strength, okay? So when you're developing x-rays, make sure you do it for 2 minutes, okay? 2 minutes. And you're going to agitate it. It means shaking it up and down, okay? The clearing test is used to monitor fixture strength, okay? The clearing test is used to monitor the fixture strength. To conduct a film screen contact test, the wire mesh test object is placed on top of the loaded cassette. On top of the loaded cassette. Remember, you can also use a coin test. You take your film, take a couple different films, you go in the dark room, you put a quarter on top of the film packet, white side up, because that's the side that would be facing the PID, which is what? The position indicating device, which is the part that goes up against the patient's cheek. When the coin is sitting there and you go in the dark room, you shut the light off, you let it sit there. Well, then you go ahead and you process the films. It's still in the dark. When it comes out, if you can see an image, you have a light leak somewhere. Plus, you can kind of see it around the doorway or maybe even in the ceiling, so make sure you're checking for that. One way to fix that, remember, is to use the insulating for wintertime around your doors. Same thing for that room. If you notice that you have that, don't have your boss pay someone extra to do it. Have them pay you extra to do it. Be a go-getter and get it done. I wallpapered an office before when the doctor was going on vacation. I offered to paint. Me and my friend Chris, we did it at Dr. Arnold's office. There's always something to do. I remember one time when I'm looking for something else, I remember one time Doctor handed me a bottle of glue. Dr. Arnold did. First week at the job, I was like, what is this? Elmer's glue? Go around and fix the wallpaper. So, that was okay. He was paying me to do that. He's paying me well. Okay, let's see here. I think we're almost done. Oh, remember, you have to have a consent form. Must be in a language that the patient can readily understand, or you have to have a translator, okay, for the informed consent. Must be in the language the patient can understand. So check your front office if you're the front office person now. Sometimes you can replace somebody at the front and they didn't have their P's and Q's together, okay? The dental record must include documentation of the number and type of radiographs exposed. You have to put down how many you took for the records. Now, x-rays are legally the but patients can get a copy of them. Radiographs enable dental professionals to see many conditions that may otherwise go undetected. An oral examination limits the practitioner to knowledge of what is seen clinically. Dental radiographs allow the practitioner to see many conditions that are apparent clinically. The Consumer Patient Radiation Health and Safety Act outlines requirements for the safe use of dental x-ray equipment, establishes guidelines for proper maintenance of x-ray equipment, requires person who takes dental radiographs to be properly trained and certified. Okay, so if you're just getting out of school, you have to have your radiology to be any use in a dentist's office. Sometimes they'll be nice and hire you, and that's awesome while you get it. And sometimes, if any dentists are watching this, sometimes dentists do pay for it or reimburse you for having it. Even though it is for your career, that is awfully nice of them to do that. So make sure you say thank you. Don't expect it, but appreciate it if they do it. A step wedge will reveal that radiographs taken at a higher KVP will have a versus radiographs taken with a lower KVP will have a long scale contrast. Will have a long scale contrast. A step wedge will reveal that radiographs taken at a higher KVP will have a long scale contrast versus radiographs taken with a lower KVP. Okay? Increasing the subject thickness will change the result in a radiograph with reduced density. Okay? Radiograph refers to that portion of a processed radiograph that is radiopaque. Refers to the portion of a processed radiograph that is what? White. Radiopaque, radiolucent. Radiopaque is white. Radiolucent is gray. Even though it can look black, remember it's gray. Don't be tricked on that exam. Okay. Listen up. When handling film with barrier envelopes, the films are unwrapped with non-gloved hands. And when handling film without barrier envelopes, the films are unwrapped with gloved hands. So you're in the dark room or you're processing somewhere, you're taking them somewhere to transporting them. Make sure that if it has the plastic on it that you took off already, then you don't need gloves on. But if you have just regular, same old x-rays that don't have the clear plastic coating on it, then you have to use gloves. Remember that. Same with if you're just starting out, just a friendly reminder, when you're cleaning up a room, you have gloves on. You wiped it all down, you have gloves on. Then you're setting up the room, you don't need gloves because it hasn't been touched by the patient. Well, these x-rays kind of the same thing. Once you've taken that barrier off and wiped them or whatever, then they're clean. So you can just go in the dark room or the daylight loader, which is the part that has the orange shield on top and you put your hands through. That's a daylight loader. After seeing the patient, the radiograph must complete which of the following procedures before washing the hands and putting on the gloves. Before washing hands and putting on gloves, you should have the chair already adjusted to your height and make sure you do it for yourself so you don't hurt your back. The headrest is adjusted for you and for the patient, okay? And you have that lead apron on. Always lead apron. Always lead apron. I don't care if it's digital and then it comes out just a little bit. cover your patient with a lead apron. We're getting we're getting wavelengths from the microwave, okay? Remember that. So you're gonna chair adjustment, you're gonna adjust the head, and then you're gonna place the lead apron on, okay? Without gloves on. Then you're gonna wash and dry your hands, okay? Now remember, when you're taking that lead apron off, you don't want to have your gloves on. If you happen to be busy, because real world, I know, you're going to take that lead apron and go hang it up real quick. Take some the side wipes or whatever wipes you use, 50-50 mix of bleach. And what you're going to do is you're going to wipe the sides of it where you touched it. Wipe it down every once in a while. You don't know what germs are in that office. The CMRS is defined as a series of intraoral dental radiographs that show all the dentureless or edentureless tooth-bearing areas of the upper and lower jaws. The CMRS is defined as a series of intraoral dental radiographs that show all the dentureless or edentureless tooth-bearing areas of the upper and lower jaws. Dentureless means teeth, edentureless, no teeth. When tori is present, the film must be placed on the far side of the torus, okay? So, let's just use Bob for a second, okay? So, Bob, what I'm going to do, okay, is look inside his mouth first to see if he has bony tori on the bottom or on top, okay? Of course, my hands will be gloved. And then, in case there's any critics watching, there's always a critic. So then, I'm going to put it in their mouth, but I'm going to make sure it goes past that bony tori, all right? Doesn't matter if it's upper or lower. Where you going, Bob? Doesn't matter if it's upper or lower. They're going to get that bony tori, and it's going to hurt, okay? And that happens over time. It's bony growth that just grows from bruxism, clenching, grinding, you name it, okay? The primary disadvantage of the bisecting angle technique The primary disadvantage of the bisecting angle technique when contrasted with the parallel technique is the dimensional distortion, okay? That is the primary disadvantage of the bisecting technique. For the maxillary premolar exposure, the front edge of the film should be aligned with the midline of the maxillary canine. Okay, so they're going to be asking you questions on where to place the film at, all right? I'll just use my face. Okay, I had a piece of paper around here somewhere. My students know what I'm talking about. It's a woman's face. Okay, so I want you to know this, okay? Remember this. These are easy to do when you use these, okay? A lot of people can do it freehand. That's fine. If you do it freehand, I'm going to upload this, screenshot it, keep it on your phone. It gives you the degrees. Real quick, if you just want to write this down, it'd be pretty easy, okay? Your maxillary incisor, cuspid, bicuspid, also called premolar, and your molars on the upper, okay? The incisor is a plus 40. So when you have that PID, okay, there's going to be a set of numbers. And it's going to say positive, it's going to say negative, okay? And you want to do positive or negative, okay? And you want to go plus 40 for the incisors, okay? 40. The cuspids, central, lateral cuspids, you want to do plus 45, okay? For the bicuspids, you want to do plus 30, okay? And then the molar, 20, okay? So remember this. The incisors 40, 45, it goes down one, or it goes up one, but then it starts to go down, 30, and then 20. Write that down. That way you know the degree. Because sometimes you'll have to take an x-ray for root canals, and then you don't have the green one, that you can keep the file from the patient biting down all the way and jamming that endo file straight down past the apex. So make sure you know these. Just have a little cheat sheet on a post-it note. You know, keep it in the drawer. It's your treatment room too. And do plus 40 for incisors, plus 45 for cuspid, plus 30 for premolars, bicuspids, and then 20 plus for molars. Now on the lower arch, okay, it's going to go like this, okay? Instead of going to be like this, you're going to be like this, okay? And then let's just get this too. Okay, just like that. So when you have it like this, you know how to put it, right? But if you take this away and you have just the film in the mouth, where do you put it at, right? Well, you just aim it. You put this in the center, right? You put it in the center of the film, okay? But then that's where you angle it. Does that make sense, guys? Okay, so that's going to be incisor, and I don't have these memorized, okay? I just know where kind of to line it up at after so many years, okay? So you want to do minus 15 for the central incisors, okay? That's these two, okay? Incisors. And then you got the cuspid, central, lateral, cuspid. So right here, when you turn the corner, okay? Those ones you can get a lot of overlapping when you're turning the corner. Okay, so you put the film in. I'm not going to do this. It's been everywhere. And then you line it up. And that's going to be minus 20. Okay, your cuspids on the lower is minus 20. This is some good information. Okay, you probably have this in your book. You can take a screenshot of it too. But still write it down. It gets to put up here. Okay, now your molar on the lower, you're going to do minus 5. Okay, minus 5. Oh, and I want to tell you guys something real quick. Say you have a dentulous patient, or say they're missing a few teeth. And you really got to use this, okay? You take 2 cotton rolls, 1, 2, and then you take a rubber band and you tie it around like this. And in that way, when they bite on it, they're biting on the cotton rolls, okay? Remember that. Let's see here. Size of Bitewing film is used to examine the posterior teeth of children with mixed detention. Okay? Detention. It's, you know, primary and permanent teeth. Size 1. Size 1 film. Okay? When it has mixture. They're going to try to trick you there, okay? So if they got primary and permanent teeth, it's size 1 film. There are 4 sizes of Bitewing films that are available. The Bitewing Tab is a heavy paperboard tab or loop fitted around a periapical film. So it looks just like a periapical, right? But you either got a tab, you slide it in there, or you would have like one of these little things I would make up ahead of time. They're little tabs, you pull it off. And you fold it, you take your time creasing it, you stick it right in the center like that, okay, and then you fold your tab up, and then put them in a cabinet, cover them up so they don't get germs on them, and then you got all your tabs pre-made up, just like that, okay. But this is not that kind. This is the digital kind for the digital sensor. I love these little things. If you see these guys, okay, let me show you how you use it. Where's my ring? I don't know where it's at. Anyway, it has a ring on it. So what you do is you just take it and you put it in here like that, and then you can make it for a vertical anterior, or you can make it for a posterior, or you can make it for a Bitewing. And it's just like the colors on the ring kits. You got blue for anterior, yellow for posterior, and then you got your red for Bitewing, okay? And then it has the arm on it. And that way you can keep reusing these if you have a sleeve over it, and then just throw these out. I love those. It took me a minute to like them. There's also snap arrays. Okay, they look like little alligators. Really, x-rays aren't too hard. If you don't want to do the memorization of the degrees, you got the ring kits to fall on. Look like what you know what you're doing. Fake it till you make it. Always remember to lay them out. If you're old school at your office, lay them out on your tray or on a bib or a paper towel because it's cheaper. You don't want to waste, because when it comes raise time, they're going to be like, well, you use all this for this. But lay them out just like an FMX, okay? Flip them over once you've exposed them, or put them in a cup so you can transport them to the darkroom. That way, you remember where you left off, because there could be an emergency in another treatment room, and they say, hey, Teresa, I need you. Well, when I get back, well, look at me. I can't remember when I'm doing which book, what book, you know, let alone the patient's going to be sitting in a chair waiting all the time, listening, ear hustling, and then they're going to come back, or you're going to come back, and, oh, I'm going to take this extra. Well, you already took that one. Well, you know, because you did it always the same way, okay? Remember that. They have to trust you guys just as much as they have to trust the dentist. The problem with a single Bitewing film per side for adult patients increases overlap contacts, okay? The problem with a single Bitewing film per side for adults patient increases overlap contacts. So they're pretty much saying instead of 2 Bitewings for adults, they recommend 4. Because if you're trying to get the whole thing, you're going to get overlapping. And the whole purpose for a Bitewing x-ray is to show interproximal decay. Okay, in between the teeth decay. And that's how you explain it to your patient. Well, why do I need so many x-rays? Well, you tell them that periapicals show the whole tooth and not but the tooth, even the part that you can't see, past the clinical crown portion, which is the teeth above the gums, okay? The root, you'll be able to see that. If there's an abscess that maybe doesn't have a fistula, a little pimple on the gums, you'll be able to see the abscess, which will show up what? Radiolucence. If you see a big grayish area, okay, because remember, x-ray is all shades of gray and stuff. If you see a big shade of gray localized, that is a abscess. But you're not allowed to diagnose ever out there. The dentist is supposed to diagnose. Even though you're already going to know what's up, you're not supposed to diagnose. Let the dentist diagnose, okay? That's what they went to school for all those years. Give them that credits. When determining vertical angulation, if the posterior indicating device, PID, is positioned above the occlusal plane and the central ray is directed downward positive, the vertical angulation is termed downward positive. Okay? I see what they're saying. When determining vertical angulation, if the position indicating device, the PID, above the occlusal plane and the central ray is directed downward, the vertical angulation is termed is positive. Okay, so okay, I see. So you gotta think about some of these questions. Even I do, because it's just so darn hot for me in my house. Okay, so you have, if it's pointing down, it means it's positive. When it's pointing up, it means negative. That's 2 questions you're gonna get right there. Okay, so when it's pointing up like this, it's negative. When it's pointing down, it's positive. So remember the opposite. I'm feeling down. That doesn't mean negative. It means positive. Okay? So pointing down, positive. I'm feeling up. It's the opposite. Negative. That will help you. That's 2. So we got Allura. We got positive and negative. Okay? Remember that. You're going to have to think, guys. Some people do not pass this exam. That frustrates me too, because there's some good people out there that really need to get this. For the molar Bitewing exposure, the front edge of the film should be aligned with the midline of the mandibular second premolar. That's kind of like a question you're going to have on your exam. So if the molar bite wing, okay? If the molar bite wing exposure, the front edge of the film should be aligned with the midline of the second premolar, the second bicuspid, okay? So line that up, okay? Now, I don't want to get you confused, but I want you to remember this, okay? When you're taking x-rays, okay? Remember, brackets will show up what? Radiopaque, okay? If you have to get further back, say they have their wisdom teeth, they're keeping their wisdom teeth, and maybe you're going to be doing a crown on a wisdom tooth. Some do, okay? What you're going to do is you can always take that sticky tab and move it, okay? Or position it further back. So you may want to have a little bit hanging out like that so you can get way back there. Especially sometimes you have to take an x-ray of a tooth that's not there. Go further back like that. Normally, you would have it to where this line right here lines up with the midline of the premolar. The second premolar. Not the first premolar, the second premolar. Also called second bicuspid in case they're trying to trick you. Bicuspid and premolar are the same thing. Okay? Now, when in doubt though, scratch everything I just told you. This is just for the working aspect of it. Say you have to get the x-ray and I aim for the middle tooth. That way I know I'll get the front and the last tooth, okay? But for your exam, it goes with taking an x-ray with the molar. You want to line it up with the premolar midline, okay? Food for thought. You got to think about that. I know this is a lot. Take a sip of something. Stretch your hands again. For the molar bite wing, expose the front edge of the film. I did that one. For the premolar bite wing, expose the front edge of the film should be aligned with the midline of the mandibular canine. So they're asking you, if you're taking an x-ray of the premolar now, what should it be aligned with? The next one, the mandibular canine. Just go with the next tooth in front of it. That's how you're going to remember it. That's what just came to me. Okay, so it's always going to be the tooth in front of it that you're going to align it with their midline. Okay? In case they say something else other than midline, you want to go with midline. Okay? Unexposed films show up clear. When the occlusal plane appears tipped or tilted, the error is drop film corner, okay? So when an occlusal plane appears tipped or tilted, somehow when this was in here, the corner was dropped or tilted, okay? And that does happen, especially if they have like different bites. If they put this in there, they'll bite down, it might tip. So you have to constantly look while you're taking that. You line it up just right. Hold still, please. I'm going to do this fast for you. Run out the room, push the button, come in. So you can open, but just don't let it fall. And then they'll go and let it hang, and then you take it, okay? Get a rhythm, get a system, be fast at it. Patients don't like them. You will be timed probably by somebody, not literally. I don't think. You never know nowadays. But they'll be making sure you go fast. So be careful going up underneath the wires. You'll get a little bounce in your step. You'll put it in. You'll line your stuff up. You'll push the button. You'll run back in and grab it. You'll get a system going. You'll get a system going. I'm sure of it. Okay. In children, size 2 film is used in the occlusal examination. Okay? So they would take size 2. This is actually size 2 film. Okay? It's the sensor. And what they would do is have the patient bite on it like a cracker, and then put the PID right like this on the bridge of the nose. Okay, I'm not gonna put this in my mouth, but you bite on it in the center of it and have the little kid and go like this. Push that button. Now, I did cut this out to put this in my mouth just to show you guys, okay? This is a occlusal film, okay? I believe that's size 4, occlusal film. And then you're going to fold it, okay? You're going to tell them they're going to feel like a duck. Because when you have just one film, okay, it's about this size, you're going to fold it. And then you're going to put the part that opens up, make them feel like a duck on the outside. And then you're going to go like this. And you're going to tell them, bite down like a cracker. Huh? And then you're going to take a picture like this. And raise the nose. And go like this. And then you go. You're not going to take it out. You go like this. Alright, so tell them, I got to take 2 pictures. And one's going to go here. And then the little camera's going to go here. And then we'll have, and I'll show you when it comes out. And then after you gently bend it back and you develop it, you'll have the upper and lower teeth all in one size 4 film. Okay, makes sense? Or you can do 2 of these. One here and one there. Okay, and throw that away. Hope this is helping. Please like or subscribe if you haven't yet. Please leave comments if it's helped you. And when you do pass your test, I really would like to know who I've helped. Okay, I need encouragement, just as you guys do. We have to stick together in this field. Blur images appear on the film when the patient has moved. Remember, you're taking that x-ray. Okay, I'm in my shorts. It's like that commercial. The guy's in his boxers, you know. But seriously, wait till you do YouTube videos on something, you know. But, so, you're taking the x-ray. You're like, okay, boom. And then you got to go around, take the other one. Boom. Okay. But the patient moved. Look, he moved on me. I said, Bob, hold still. And what did he do? He moved. Can't get frustrated with your patient, guys. You cannot get frustrated with your patient. Okay. By the way, I'm in shorts, not boxers. I just thought I'd clarify that. Make you laugh or something, you know. Like I said, I've always taught my girls, my students, as if I was their co-worker. And you gotta have fun at work. Okay, let's see here. When the occlusal technique is used, the patient gently bites on the surface of the film to stabilize the film. They might ask you degrees, so I would start studying that. There's a few questions on degrees, but it probably won't be that many. But try to remember that, okay? Make a song up, a rap song up. If you do, let me know about it. I'll share it on my page. Might get famous with that, and not even have to do dental. Don't quit your day job yet. Get a day job if you don't have one yet. Green sensitive film must be paired with intensifying screens that produce green light. Okay, so remember, green sensitive film must be paired with an intensifying screen that produces a green light. Okay, the screens when you have a Panorex, let me tell you something about this too. Okay, I'm gonna take these. This is my film. This is my pretend Panorex envelope. If anybody has one, a dentist watching, and you have anything that's old you need to get rid of, right here, I can use it, okay? School doesn't provide the supplies. I'm subcontracted. I do it. Plus, I tutor, so it would help on the side, too. So, you got your envelope. Okay, so you're going to take out the intensifying screen. You're going to take it out, right? Like that. But then you're going to open it up all the way. Okay. Be sure not to move it around in the dark room. Just open it up. Unfold it. Then you're going to take out the film. Okay. If you leave it in the envelope like this, and you don't even take the intensifying screen out, you're just trying to cut corners. Okay. Take it out. Did you hear that? Okay, you're going to call static electricity. And you might be asked what that is on the x-ray or on the exam. It's going to look like bunch of electricity, okay? That's because of your misdoing, okay? Remember that. You have to take the whole thing out, open it up, take it out, put it in. But nowadays, a lot of it's digital, so, you know, we don't have to worry about that. Okay. The most common extraoral film is the what? The pan. Have you had one? Every 1 to 5 years? You know, you're supposed to have one every 5 years. If you're working in front, if you're an assistant, everybody in the office should be on cue. Are they due for a Panorex? Remember that. That's how you get some points there. People overlook things. People don't want to take things. You could be the one that stands out in your office. Always know, has it, or how many x-rays can they get a year? The code is 0274 for 4 Bitewings. 0272 for 2 Bitewings. That's pretty easy to remember, right? But check with the insurance company. How many can they have? Some places might let you have 2 sets of Bitewings a year instead of 1. Everybody's insurance is different. And then, like my student Sierra, you know, who is a office manager now, or the student that got hired with her, Mackenzie, shout out, I couldn't resist. You know, you guys working together, double check each other, you know what I'm saying? You know, get the points and tell the boss, hey, they're overdue for Bitewings. Okay, I want you guys to do really well out there, and everybody else, take note of that. I'm looking, hang on. When the right angle technique is used, an occlusive film is exposed, directing the central ray at 90 degrees to the film. Extraoral radiographs may be used in conjunction with intraoral films. The images seen on the extraoral films are not as defined or shaped as the images seen on the intraoral radiograph. Both these statements are true. Might be some true false questions on there. So extraoral, the outside x-rays, may be used in conjunction with intraoral films together. But sometimes the insurance won't pay for a Panorex and a complete FMX. Okay, so know that. They might pay for the pan and 4 Bitewings. You have to know this. Okay, or your office manager is going to get on you if you're not the office manager. And one day you could be. You can do anything. I started off in high school, 2-year dental assistant course. That's it. I've been an office manager. I've been, well, I'm a teacher now, you know. I've been chairside. I've been ortho. I've been just about everything you can think of. Even a floater. That's how I started off with, making $5.75 an hour. And nowadays, you guys are going in there starting off at 15, if not more. So you guys are in a good place right now. And social media, videos like this, helping you, educating you. If you're one of those dental geeks like I am, dental nerds, you know, it's going to pay off for you, okay? You need to be knowledgeable because you are taking care of people, okay? Remember that. These are people you're taking care of. We can get so used to looking at those teeth. I'm getting sidetracked, so here we go. The following structures appear as radiolucency, grayish, on panoramic radiographs. I'm going to spell this word out for you. My speech problem back when I was 5 years old is coming back. Periterium gallamaxilla fissure. Periterium gallamaxilla fissure. And in case my closed caption misspells it bad or it has any bad words while I'm thinking about it, I'm so sorry. But here we go. I'm going to spell it out. P-T-E-R-Y-G-O, maxillary. You should know how to spell that. That's all one word. Fissure. Just in case you don't know how to spell maxillary. M-A-X-I-L-L-A-R-Y. Okay? Fissure is the structure appears as radiolucency on a panoramic radiograph. You guys are going to ace this test. You can do it. I'm going to be your cheerleader, okay? To compensate for strips found in the grid, increase exposure time, must be used to expose a film. To compensate for the strips found in the grid, you must increase exposure time in the film. The following is the fastest recommended screen and screen film combination. Rare earth screen with green light. Once again, green. So if you see blue, blue-green, yellow, orange, UT orange, whatever you see, green is go. That's the answer, okay? Which of the following is the fastest recommended screen and film combination? Rare earth screen and green lights. On a panoramic radiograph, the coronary notch appears as blank to the coronary process. Concavity located distal. Ugh. Guys, yeah, you'll feel my pain one day. On a panoramic radiograph, the coronary notch appears as a concavity located distal to the coronary process. Yeah, that's going to be on the exam, okay? Concave, bent in, right? Shaped it, okay? We're talking about that. Located distal. On a panoramic radiograph, the ear is viewed superimposed over the styloid process. Okay? Repeat it one more time. On a panoramic, the one that you can see the whole thing, the ear is viewed superimposed over the styloid process. In the dental setting, interruption refers to an explanation of what is viewed on a radiograph. I'm almost done. Radiograph, whereas the term diagnosis refers to identification of disease, examination, or analysis. A, both statements will be true. Okay, in a dental setting, interruption refers to as explanation of what is viewed on a radiograph, whereas the term diagnosis refers to the identification of disease by examination or analysis. Okay. Guys, I hope this helps you. If you want a copy of the practice exam, I do have a link for it underneath the video and on the website. My daughter would like to say hi to everybody around the world that is learning dental assisting radiology. Alright. Okay. Let's see here. They're not back yet, are they? Huh? No, are they back? The boys? Okay, sorry guys. Let's see here. Baby, I'm working still. Hang on. No. Infection control practices must be implemented when exposing and processing radiographs. Tube head and exposure control switch must be protected with barrier covers. Remember that, and they said that you don't have to wipe them off. But I do. Personal protective equipment must be worn during a patient's contact. Never take x-rays without having gloves on your hands. Okay? Oh, another thing about dark rooms, I remember. Make sure the countertop is dry. The person before you could have left it wet, and then you lay your x-rays down, and then the room